Hi, hello everyone. I am Dr. Sulochana Gurung, your dentist, and I am here with another episode segment of our ToothTalk Thursday today. Hope you guys are having a wonderful Thursday. I know the weather is crazy. I hope you all are safe and safe. Safe. So, yeah. Before we start, can you do me a huge favor if you guys can type in what part of town you're watching me from at the comment section below so that I know that you're here and I can say hi. Okay. Um, so I would like to share a little bit about our practice. As you all know, again, we are a brand new dental office here in the heart of Queens, New York. We're building it as a state-of-the-art facility, and we're located in 8710 Northern Boulevard, Suite 204, Jackson Heights, Queens, New York. Our goal is to serve our community, treat patients with beautiful, natural looking dentistry using top of the line technology. We are committed to giving you that amazing, exceptional wow experience and creating beautiful smiles. Oh, yeah. Hi, Brave Rajan. Yeah, so giving you guys a little bit update on the project. The construction is going on in full swing. We're having some inspection next week, so yeah, hopefully it goes well. So we decided on our brand logo, and I cannot wait to share it with you guys. So stay tuned for that. I know our designers came up, worked so hard and came up with so many beautiful ideas and designs, and I'm really happy with the one I picked. But it was a tough decision. So I'm kind of excited to share that, like hopefully, like soon. And the next thing is, I know I'm going to be traveling to Seattle next week for this amazing course, so I'll be gone for about a week. But don't worry, I'll keep you guys posted on my progress. And so let's begin. So I get a lot of questions. Well, why do I need a root canal, and what does it mean to have a root canal treatment, which is also called RCT, right? So you all know about it. So if you have any questions, you can write them at the comment section below and I'll address them as they come. As in my previous videos, I talked about different layers of teeth and how the outer layers of dentin and enamel covers the inner pulp that has nerves and blood vessels. So that keeps the tooth alive, right? So I just have a little model of the teeth here. I know they just happened to arrive today, so this is like a little replica of what we have in our teeth. So yes, so in the past I mentioned how small caries or cavities that causes cavitation in the tooth, that does not hurt like when they're small. So they start hurting when they are close to the nerve or into the nerves. That means the bacteria gets inside the nerves and the blood vessels. Uh, and the small cavity, slowly or rapidly grows into that nerve canals and causes serious pain that can be treated by root canal treatment. So let me just show you like what I mean. So, you can see like a little, these dark spots here. So just imagine they are your cavities, right? So they are very small, they do not hurt, they kind of like tend to stay within the top, like the outer layer of the teeth. And eventually, so as if you don't treat them like at this stage, what happens is the bacteria tends to grow and goes into the nerves. It gets into the nerves and canals, where as you can see these red ones here. So those are the nerves and the blood vessels. So once the bacteria enters there, there's no way of there's no returning back of the bacteria. So you have to get root canal treatment. So what is root canal treatment? It is basically a procedure where we anesthetize the tooth. That means we numb the tooth up first, place like a little layer of rubber dam on top that will create that will lessen the chances of more contamination. Clean the canals. That means those little tiny canals using little files and brooches. So once they are cleaned and nicely, those infected debris and nerves are cleaned out, we disinfect the canal and which makes it sterile. Throughout thoroughly cleaning it and once it's all nice and clean, we fill it with biocompatible material. We commonly use gutta percha, which is a thermoplastic material, and it's biocompatible too. So it seals the tooth and makes it resistant to attack and more breakage. So the tooth will gain its strength back again. So we fill the remaining part of the teeth, cover the top part with simple filling, post-in core, or and crowns as needed. So why do we do root canals? In case when bacteria has entered the canal by cavitation and infected, that's when, like why you do root canal. Oftentimes they are asymptomatic. That means they are symptom free. Or sometimes they are symptomatic. That means they tend to have, they tend to give you pain and sometimes severe pain that will wake you up at night. They affect your eating. They affect, cause fever or loss of function. That means you're not able to like chew or eat anything. Sometimes it's also called pulpitis. That's when it's into the nerve, exactly in the nerve, but the infection has not gone all the way down to the root, like all the way down to the root ends. So there's another condition called chronic apical periodontitis or acute apical periodontitis. That means when they have the infection has reached the root ends. Can you see these like two dots here? So when the infection has reached the ends, reached those ends of the root, that causes condition of periodontitis, sometimes leading to abscess or cyst at times. If these left untreated, it may cause space infection that will affect the entire jaw, and it will have to be treated with additional measures and antibiotic therapies, or sometimes incision and drainage. We just have to cut the gum open and drain those bacteria, or pus from the root end. So there are different procedures involved as well. Some cases can be asymptomatic, like I mentioned earlier. That means there may be nerve damage, but there's no classic inflammation or deep caries. So it may be only case of necrosis. That means the tooth is dead, but you don't know why. Or sometimes it may be dead because of some kind of trauma. When the tooth is dead and it does not show symptoms, right? So that's asymptomatic. And in such cases, we need root canal as well. So other conditions needing root canals are trauma. So like I mentioned earlier, if tooth undergoes some kind of trauma because of any accident or fall, or a severe blow to the tooth, in case of like any blow to the tooth, like if you get into any fight or somebody punches you, that will likely, leaves the tooth non-vital. That means, yeah. Some cases when you're trying to place a crown in the tooth, what happens is if they are at an off angle, but you're trying to like straighten your teeth, what happens is when you're cutting around the tooth to get the crown, the tooth may need a root canal treatment. So it is called elective root canal. So what happens is this is to straighten your teeth, the position of the teeth, or to give like enough support from the canal part of the tooth. That is another indication as well. So yes, to summarize, I would say do not wait for long to get treatment for those small cavities, or else the tooth might turn into something more, the treatment might turn into something more invasive, and it will more oftentimes, you may have to go like to your dentist like multiple times, and so it's more invasive treatment, right? So you would definitely want to avoid that. And of course, the root canal treatment is more expensive versus simple fillings, and again, it needs more treatment as well. So if you need root canal, do not wait for a long time to get the treatment done, because what happens is infection may travel into deeper areas of the jaw, like I showed you earlier. So the roots are very long, right? So they're like deep inside the jawbone. So once infection reaches deeper areas of the jaw, Other parts of the body can be affected too. So it may travel into the nose area, the sinus area, the like the orbital area that's around the eyes, or sometimes the head and neck region around the throat. That's even severe, or the neck region. You get what is something called Ludwig's angina, or it may travel into your chest, or lungs or heart. So it's very like those are very severe conditions. So you would definitely want to get treatment earlier than later. So yeah, so this is all about root canals, and if you have any questions, do not hesitate to contact us. I know for now, like we only have our emails and phone number in the Facebook page, but we should have our website up pretty soon. I'm very excited about it too. And the other thing is, yes, do watch our video for the Project I Smile that I announced the other day. And of course, do apply if you think you're in need of any dental treatment, or any of your loved ones or any colleagues or friends, or someone in the family need one. So do not, don't hesitate to apply for the Project Smile competition. That's another way of, serving my community, I would say. And yes, I'm very excited about, reading all your stories. Uh, and yes, definitely, we will be letting you know the date we'll be starting to schedule patients. So it should be pretty soon. Stay tuned for that as well. So let me go over the questions, see if you have any. Uh, oh, nice. Okay, so let me see. Sure. So again, do not hesitate to contact us for any questions. If not, we will see you guys in about a week, and I'll keep you updated on my travel. And of course, like stay safe in this weather. And yeah, take care, guys. Bye.